And late today, there was a setback for the vaccine made by Johnson & Johnson. A CDC advisory committee advised against taking the J&J shot, recommending Moderna and Pfizer vaccines instead. The committee cited increasing evidence of a rare blood clot disorder linked with the J&J vaccine. This comes right as experts are warning that Omicron is likely to become the dominant strain in the U.S. For a deeper look at all of this, I'm joined by Dr. Eric Topol, founder and director of the Scripps Research Translational Institute. Dr. Topol, great to have you on the NewsHour. I wonder if we could talk about this J&J recommendation first. What do you make of that?
Well, great to be with you, William. I think the committee review of the J&J data was very sound. That is, it was a unanimous vote that the Moderna and Pfizer vaccines are safer. They have a great track record. Unfortunately, the J&J shot has been accompanied rarely with these very serious bleeding clot issues and 9 deaths. So it's best, if possible, to avoid it.
Okay, let's turn more broadly to Omicron. We know that it is incredibly contagious. It certainly seems to be. Given that, do you think we are really headed for a bad winter?
Unfortunately, it's unquestionable at this point. This is a virus strain that's doubling just over 2 days, which we've never seen anything like that. We're seeing it light up in the UK, in Norway, and Denmark, and it really is exponential growth, the likes of which we haven't seen since the pandemic started. So it's inevitable that it's going to hit the United States, and it already is rising very quickly. And unfortunately, a lot of people haven't appreciated that this is something we can't avoid right now in terms of this it has to be seen as an onslaught of Omicron new cases.
Some people have, looking at the cases that already exist of Omicron, have jumped to the conclusion that it is milder with regards to its virulence. Do you agree with that?
There isn't any question. Fortunately, it's milder. But the problem is that people are ascribing that to the virus. And it's not related to the virus. It's because we have so much immunity built by our vaccines, by our boosters, by people who've had prior COVID. We have no evidence that the virus itself is more mild. And until we have that, we have to assume that people who don't have any protection are highly vulnerable to getting very ill.
We have been seeing also a lot of breakthrough cases. I mentioned earlier these colleges and universities that are seeing these really explosive case numbers, largely amongst vaccinated and boosted groups. Do you think that universities and colleges are special circumstances, or are they a harbinger of what's to come for the rest of us?
Yes, what we saw at Cornell and now subsequently many other universities is a sneak preview. The rapidity that it spreads to, hundreds of students. In the case of Cornell, 97% were vaccinated. This is what we're going to be seeing throughout the country over the weeks ahead, as this becomes a dominant strain, not just, of course, in the US, but throughout the world. So this is the kind of rapid spread that we have yet to see until now in the pandemic.
I mean, I feel a bit like a broken record here, talking about the need for good masks, better ventilation, vaccinations, boosters, rapid testing when possible. Given what we know about Omicron, would you add anything to that? Would you change anything to our general precautionary principle now?
Well, the things you've mentioned, William, are certainly the cornerstones of our prevention and blocking the spread. We don't have the rapid tests that we need in this country, unlike many other places. We don't have enough people who have been vaccinated, no less who've had their booster shots. We're lagging way behind. We're 65th in the world for vaccination and lagging most countries who are onto the booster shots. And especially in people of advanced age where the risk is considerably high. So we're just not using the tools we have. If we use them all, we'd be in great shape to fend off Omicron. But unfortunately, we're just not doing it.
One last question I want to ask you, an argument that I hear a lot, which is, come on, these are largely mild cases, 99, the vast majority of people will get through these cases, that all of this talk about Omicron is fear-mongering. What do you say to that?
That couldn't be further from the truth, William. We may well get beyond 1 million new cases a day. Not only will many of those people get sick, some will wind up in the hospital and die, but also we will be fostering a lot more long COVID, the chronic disabling features that could occur from Omicron, no less culturing the virus further for something beyond Omicron.
All right, Dr. Eric Topol of Scripps Research, thank you so much for being here.
Thank you.